The drugs are known as non-steroidal anti-inflammatory medications, and they've been in the news for years now. In 2003, Vioxx was taken off the market because of cardiovascular risks. Later, the FDA added a black box warning to Celebrex, its strongest available caution. Now, a new study looked at other drugs to determine which should be taken with care.
But we're talking about drugs that we use every day. We're talking about Motrin, also known as ibuprofen. We're talking about naproxen, also known as Aleve. We're talking about Voltaren. So these are commonly used drugs for aches, pains, menstrual cramps, etc.
Danish researchers looked at national medical records of more than 1 million healthy people
and looked to see if there was any effect in taking pills that you and I take every day.
What they found is that different drugs had different heart risks. Voltaren, commonly prescribed to treat headaches, arthritis, and injuries, was associated with a 91% increase in fatal heart attack and stroke. That's higher than Vioxx. Ibuprofen, that's Advil and Motrin, carried a 29% risk. Naproxen, or Aleve, had no increased risk.
I think we have to pay more attention to these drugs. I think these drugs are not created equally. I think people shouldn't just take these haphazardly.
People with heart problems should be especially cautious, but this study shows even healthy people should consider the risks.
The data does suggest if you have to take these medications, and many patients do, that you should try to go on the lowest dose for the shortest period of time. The people that got themselves in trouble were high dose over a long period of time.
While aspirin, Tylenol, and Aleve were not associated with increased heart risk, aspirin can cause stomach problems. Tylenol can cause liver damage if taken excessively, and Aleve may lead to a slight increase in your blood pressure. So take all pain medications with caution and talk it over with your doctor. Robbie?